Welcome to my YouTube channel Nutrition and Health, and my website nutritionandhealth.xyz. We will discuss health disease treatment. If you want to read article, you can check my website link in the description. Congestive heart failure and heart disease expert advice. For Doctor Society of Radiology, scanners and magnetic resonance imaging are the most suitable for detecting and monitoring the development of coronary diseases. Heart disease, or coronary artery disease, remains today one of the main causes of morbidity and mortality in France and in Western countries. It is favored by the presence of cardiovascular risk factors, such as arterial hypertension, diabetes. These deposits will schematically generate two types of complications: an acute complication, myocardial infarction, and a chronic complication, angina or angina pectoris. Occlusion of the coronary artery and deprive the underlying myocardial muscle of the blood supply it needs. This is the death of the myocardial cells. Angina pectoris is another complication of coronary artery disease, following a chronic narrowing of the caliber of the artery, called stenosis. Stenosis causes a decrease in blood supply to the myocardial muscle. At rest, the coronary flow is often sufficient, while during exercise the flow becomes insufficient, and this is where the symptoms appear, most often pain in the chest, which can classically radiate into the jaw and the left arm. Early detection of coronary diseases, therefore, essential in order to allow the implementation of appropriate therapies that will prevent the rupture of atherosclerotic plaques and their progression. An extremely low complication rate, MRI, an essential examination. Non-invasive cardiac imaging has undergone rapid development over the past 10 years, which owes a great deal to technological improvements in X-ray scanner-type machines and magnetic resonance imaging. CT scan of the coronary arteries, or coroscanner, is now routinely used to screen for coronary artery disease in symptomatic patients with few or no cardiovascular risk factors. The examination lasts about 15 minutes, installation included, and allows an exhaustive visualization of the coronary arterial network. The scanner of the coronary arteries is of course much less invasive than coronary angiography because it only requires the placement of a venous infusion and the injection of contrast product, while the latter requires an arterial puncture and the use of intra-arterial probes to inject the contrast product directly into the arteries. The complication rate, reported in the literature, of the CT scan of the coronary arteries is extremely low. The cardiac scanner not only detects coronary stenosis but also accurately analyzes the wall of the artery, in particular by evaluating the risk of rupture. Beyond the positive result of the cardiac scanner, it is above all a negative result that will interest the doctor, since a normal cardiac scanner is synonymous with a very low probability of a cardiovascular event medium and long-term. Cardiac CT is therefore particularly suitable for patients with no history of chest pain and who have few risk factors. A normal result will reassure everyone, patient and doctor alike. Magnetic resonance imaging has become an essential method for the evaluation of coronary disease. Unlike the CT scan, the main advantage of MRI is not to directly visualize the coronary arteries, although this may be possible in the years to come. MRI has above all become an essential examination for detecting the impact of coronary disease, either acutely through the evaluation of the scar of myocardial infarction caused by the rupture of the plate, or chronically, by evaluating the impact of stenosis on cardiac muscle perfusion. Cardiac MRI takes between 30 and 40 minutes in trained centers, installation included. MRI is the reference examination in 2015 for the functional and structural evaluation of the heart. The main current limitation is its availability, which, due to a lack of equipment, further limits its distribution in certain centers. The coming year should nevertheless confirm its central place in the diagnostic strategy of coronary disease. Thus, the new non-invasive imaging methods, CT and MRI, are adapted to each situation for the detection of coronary disease and its complications. Their increasing distribution in imaging centers already benefits a large number of patients.